and we try to maintain the temperature. Next, we also should wash unpackaged. um, I think so. Next one. So we should also dispose of the food packaging and food waste appropriately, and particularly if there is anything which falls off on the floor, or which which is unused and maybe are left uneaten by children, we can give it to birds, or we can dispose it off into the closed dustbins, etc., and make sure that it doesn't invite pests. We should wash our hands with soap and water for at least 20 seconds before eating, before cooking, before handling any food. And we should also ensure whoever is handling food in the home, should follow the same precautions. And we should, if we, maybe we can use many ready-to-eat canned foods, etc. These days, many people are using those options to save on time, or to even prepare for, case when maybe fresh supplies would not be available. What is important is that there should be no visible spoilage and no foul smell or swollen packets or cans. Next one. Next one, please. And while purchasing, what is important is that we should minimize, first of all, our trips to the market. It is a lockdown period, and we are right now fortunate to have the permission that for the essential items we can go out. But as again has been already pointed out, that if we don't I'm sorry, use the lockdown properly, we may finish the 21-day lockdown period without any result. What is important is that each one of us ensures that lockdown achieves its purpose by actually maintaining the physical distance and yet supporting each other emotionally. So we can designate one person to go out and buy the items and prepare the list beforehand. We can try and make sure that maybe at least for a 1 week supply we can get from the market at one go. And when we choose this person, it should not be an elderly or a pregnant lactating mother or children who are like our high risk groups. So we should try to avoid that as in the families wherever it is possible. And while purchasing the items, it is very important to maintain at least 1 feet distance. So maybe we are getting many visuals on the social media where people are standing in their own designated places. And we should really explain these precautions to even the health people around us, and that they have to observe proper lines, and they have to stand at a distance, and that non-perishable items definitely can be stored easily, and the cereals, pulses, so we can get them for a period of time. And certain vegetables which last can be brought, and maybe we can depend, we should leave very few items which are totally perishable or easily perishable. Those can be replenished if required at a need as per the family. As far as there is a tendency to buy a lot of packaged or chips and those kind of food. What is important, this is again for both pregnant mothers as well as for the general population, is to avoid buying all foods which are high in fat, salt and sugar, because they tend to increase, their increased consumption, I would rather put it this way, will increase our risk for overweight, obesity and various cardiac, diabetic and other associated conditions. And we know that comorbidities of heart problems, diabetes, increase the severity of the COVID-19. And also, so far the fatality has been observed more in the people who had comorbidities. So it is important that we continue with whatever medications and precautions we were told for our diabetes, for our high blood pressure, for other conditions. And we also continue to try to avoid these foods as far as possible. Next. We should not touch our face, and all those hygiene precautions we must take while we are in the market, or as soon as we come home. We can use separate set of slippers or clothes. As soon as we come home, we should wash our hands with soap for 20 seconds. We can keep a separate bag and it can be cleaned and disinfected, and especially we are going to shop once a week or something, it can be easily cleaned and maybe sun dried before next use. And the precaution regarding already the purchase of packaged items I have already shared. Next. Next. So transmission, is, so far we know that there is no transmission from food or food packaging, but that does not mean we should not be careful, because it is a surface or object, any is contaminated, then there might be a chance that if we have touched that substance and we have also touched our face, that we may get the infection. So any close contact with other people while shopping or receiving or holding, keeping our hand on some counter, etc., we should avoid. And we should definitely be very careful. So as soon as we come back, we should wash our hands, or if possible we can even use gloves. Important is that chicken and like there is a lot of query or this thing about non-vegetarian food items, whether they can be consumed or not. If they are cooked thoroughly to the right temperature and they can be consumed, there is no evidence of them causing any infection. But when we are handling any non-vegetarian food, it is important not to touch our face while handling or immediately after handling them. And as soon as we touched any of the non-vegetarian food, we should while cooking, where we could be exposed to the surface, we should immediately wash our hands with soap and water for 20 minutes seconds as already prescribed. Next. Now coming to, there is like, we are always looking for immunity boosters. What I would like to say is very clearly that actually the immunity booster is a well balanced diet with 30 minutes of physical activity for adults, and about 60 minutes of physical activity for young children. 20 to 25 minutes physical activity, already it's been touched by Dr. Patel, for pregnant mothers is also recommended, and they should continue with their walks. Proper sleep. So I would say there are 4 or 5 key boosters, which is proper sleep, staying well hydrated, staying healthy and well balanced diet, and incorporating certain foods which are known to improve anti immunity. So these are antioxidant foods, protein foods, iron rich foods, zinc, selenium, and certain omega 3 and omega 6 fatty acid. But there is no like, these will overall improve our immunity, and a good immune response can help us fight better fight the infections. But at including these foods and not observing the precaution is not going to lead to not get us getting not and I mean us prevent infection in us. So dark green leafy vegetables, whichever are available, vitamin C rich foods, lemon, orange, amaranth leaves, etc. Yellow orange fruits and vegetables, which are a rich source of vitamin A, are extremely like protective. I have like, regarding papaya, there is a myth that it is in pregnancy one should not take papaya. However, actually, there is no evidence that properly ripe papaya causes any abortions. But if there is a stern belief of this in the community, then we can recommend orange, mango, we can recommend carrots, we can recommend dark green leafy vegetables, milk, liver, whatever is acceptable to the community as a vitamin A rich food. We can also include almonds and walnuts and various nuts. These are protective against various even chronic conditions, and they also boost immunity. And millets, wherever possible, we can include in our diets. Whole pulses, legumes, non-vegetarian foods, curd, paneer. Non-vegetarian foods, the important precaution is that they should be thoroughly cooked. And safflower oil and sunflower oil, cornflower oil, these are rich in omega 3 and omega 6 fatty acids, so they are helpful. And certain herbs and spices and condiments which are part of our Indian diet, in many ways. Ginger, garlic we've been using for our, and turmeric, cloves, in our day-to-day cooking can be included, and black pepper. If somebody wants to have tea with the black pepper, ginger, added to it, or tulsi, basil, they are mint. They can be definitely included. And so, but important is that we cannot say only one food is a superfood. If we will include a well balanced diet, as already explained, we will have proper sleep of at least 8 hours. We will stay hydrated by drinking at least 8 to 10 glasses of water. And if we can be physically active and observe all physical as well as food borne food related precautions to have hygiene, we can prevent the infection. In We have already, it's the anxiety, fear, and role of depression in pregnancy has already been very beautifully covered. But nutrition, certain, as it is, the pregnancy is a period of fear and anxiety, and during pregnancy, including omega-3 fatty acids, which come from flax seeds, walnuts, fish, or marine foods, folic acid, which comes mainly from green leafy vegetables, and certain rajma, soybean, certain pulse legumes, and fish, and mango. B12, which is mainly found in the non-vegetarian foods, milk, egg, chicken, salmon, and B6. These are nutrients that have, they can help have optimal levels of neurotransmitters, and they have role in anxiety and sleep, and they can increase energy levels and appetite. Next. So what is the thing is that further, by observing all these precautions, we can improve our response. We should look for any signs, danger signs of high risk or obstetric emergency, and seek care, and the numbers are there on our screens. So if required, we should really seek help. uh, with that, I think I would like to close. There are a lot of guidelines, there are messages which are coming, and water is generally, thought to be soothing to the sore throat. There is no harm, we cannot say whether it will actually kill the microorganism or not. Maybe Dr. Jamil can answer that better. However, that is definitely soothing and can be consumed. There is no harm in that. So a good way to improve the overall protein quality is also, if they cannot, they can consume wheat flour along with some, pulse flour in the when they are making rice, rotis, etc. So in a 5 kg of cereal, if some 1 kg of pulse can be ground along with it and can be included, it will even improve the protein quality of whatever little protein they are getting, and that will improve the quality. Then depending on the local, if they are not non-vegetarian, it is not necessary that good quality protein or the protein requirements can only be met from non-vegetarian foods. Cereals and pulses, when consumed together, that is either as dal, roti, or chawal and dal, or like I said, if we combine in the flour itself, can improve the overall quality of protein. And it can, the good quality protein, there is less requirement. So we can include milk and milk products, we can include pulses, nuts, whatever is acceptable and available for that community, if they are not if they are not if they are vegetarian.